Sejal and you're watching the series of Future Talks conducted by Prayaana. Let's take a look at what Prayaana is. Prayaana is a unique employability, entrepreneurship, and innovation ecosystem for women. Prayaana Labs gives wholesome career support services right from career counseling, training, mentoring, and recruitment services all under one umbrella. Also, check us out at www.prayaana.org. If you are a student or a working woman or a woman who wants to resume her career after a long break and upgrade your skills, then Prayaana undoubtedly is the right platform for you all. To join us, you can register at www.prayaana.in, or you can also download our Prayaana app from Play Store. It's a community hub where you can network and share your thoughts and queries with women of similar interests. We also provide membership programs and learning modules over international and well-acclaimed mentors. So check our app right now. Prayaana Collective or Prakol, India's first e-commerce platform that is dedicated to the empowerment of women. The platform is uniquely designed with an attractive affiliate marketing model where all the customers are given an opportunity for lifetime savings and earnings. Also check us out at www.prakol.com. Well, today we are here with the 108th episode of the Future Talks. Staring at laptop, television, and mobile phones has increased several folds during the coronavirus lockdown. Due to work from home, you might be spending most of your time glued to your laptop screen, and the other half of the day must be spent watching movies or scrolling through your phone. This excess of screen time usually tries our eyes to maximum extent. It can lead to red eyes, puffiness, and even dark circles. To solve all our problems, we have among us Dr. Sachin Mathew, sir, who is going to take a session on the occasion of World Sight Day. He's going to take a session on impact of COVID situation on eye health and wellness of dependents. Let's take a look at his profile. Dr. Mathew George did his 3-year basic ophthalmic training and a 2-year clinical fellowship in cornea and microsurgery from Arvind Eye Hospital. He did his post-graduation from Institute of Ophthalmology, Coimbatore. He was a fellow of the Royal College of Surgeons, Glasgow. After his fellowship, he was working with the National Health Group, NHG, and Alexandra Health in Singapore for 10 years. His special areas of interest include cataract, ocular trauma, corneal, and external eye diseases. He's currently working as a senior consultant at Chaithanya Eye Hospital, Palarivattom. I welcome you, sir, on behalf of Prayaana. So without any further ado, let's get started with your session. Sir, you're on mute.
Now it's all right?
Yes, okay. Perfect. Yeah.
Thanks. Thank you very much for inviting me for this wonderful session. And I could know a little more about Prayaana also now. And let me share my video one second. Are you able to see my screen?
Yes, sir. Yes, sir. It's perfect.
So, we are going to talk about impact of the COVID-19 situation on the eye health and wellness. As the moderator just told about the overuse of monitors, and the digital eye strain, which is getting more important nowadays. That is more important. I'll come to that. And before that, I think we have to put a little bit of stress on the eye health and wellness of our dependents also. At this stage, what is the importance of that? And what is the impact of that COVID, the current scenario on this this problem also? Right. One second. All right. So, what is the importance of giving the talk today? Is because it's the World Sight Day. World Sight Day is actually an annual day, which is held on the second Thursday of October globally by the World Health Organization, which focuses the global attention on the blindness and visual impairment. And this year it falls on today, actually, 8th October. And the theme this time is Hope in Sight. Actually, it is quite, relevant, because hope in sight means nowadays everything is a hope now, because of the current scenario. So I'll come to that, why that thing is significant in the current context actually. So the World Sight Day, the theme this year is Hope in Sight. Okay. Now, without much ado, I mean, we'll come to the topic, and everywhere we are discussing about this, and we are discussing about the SARS-CoV-2, that is the respiratory syndrome, and it's caused by COVID-19, and what is the connection between the eye and the relevance of that. And this is a picture where I got it yesterday actually. I mean, from John Hopkins, their website actually gives a current idea about what's the situation globally. You can see there is 35 million cases now, and India is the second now. It's 6 million cases, and in Kerala is also, I mean, it's contributed to almost like 10%. In the last 1 month, it has been quite bad actually. But there is a little bit of relief today. I mean, today just now I was just referring, and today's case number is only 5,000 actually. So that is actually something good. Even with the testing is almost like the 63,000 actually. So at this scenario, there is a general paranoid condition. I mean, everyone is scared. Obviously, you should be scared about that, and people are not coming out in this scenario. How is it affecting the eye health? So that's what's more important. So COVID-19 pandemic has forced patients to miss their eye appointments by almost like 3 to 4 months. I mean, even now it is almost like 6 months now. And in the initial phases, it was almost like totally no ophthalmic appointments, and we were like falling back. But now at least people have slowly started coming back. But it still, there was a big lacune there. And almost 35% of India's elderly patients living with some form of visual impairment. That's a study by Journal of Family Medicine and Primary Care. And majority suffer from ailments like cataract, glaucoma, or retinal diseases that could lead to blindness if not treated or diagnosed in the time. So that is why this is more relevant, because COVID-19 is delaying the eye appointments, and some of these ailments which needs the early diagnosis and treatment is getting delayed. So that is why that's significant. Now I'll be generally talking about the eye conditions which needs early referral and diagnosis before coming to the digital eye strain, which is more important. So some of the conditions I discussed, which usually is seen as cataract, retinal diseases, red eye, and finally the refractive errors and digital eye strain. So before coming into the more relevant and this thing, and this is also quite important, especially in our dependents. So cataract, before the commonest disease what you usually see, you can see that in the normal eye, the light which is falling from on the cornea, it passes through a clear lens and it falls on the retina. That's how you see. So that is how the light is focused sharply, producing clear images. But when the lens is getting cloudy, like in a cataract, what happens is the light which passes through that, it gets scattered or blocked by cloudy lens, causing foggy images. That is what is happening in cataract. In an early stage, it may be not causing much of a problem, but late stage, that is why the significance of delaying the diagnosis. I mean, if you wait for that, slowly it gets more and more foggy, and it causes this preventable blindness. Right. So this is a picture of an early cataract. I mean, you can see that here. I mean, from outside itself, you can actually see a greenish yellow color, and that is like around grade 2, we would say. I mean, this is the ideal stage to do a cataract surgery. But because, I mean, this is the surgery we usually do. I mean, at this stage, it's pretty easy. And nowadays, the cataract surgery is becoming like a daycare surgery, and it's quite easily done at this stage with a dilated pupil and all. These are some of the steps of the surgery, and we put a artificial lens inside. So at this stage, an earlier stage, if we do the procedure, it becomes easier for the patient by the post-op recovery and for the surgeon for doing the surgery. So that's why an early diagnosis and referral is very important in a case of cataract. And what happens if you wait? Or what happens if you delay the diagnosis? Like, for example, nowadays, I told you initially there was around 3 to 4 months of waiting period. Now the patients have slowly started coming back. Now we are seeing more of mature cataracts. The cataracts has already become white. So what happens, I mean, when a mature cataract, so what happens is like it becomes something like this. So you can see that, compared to the early picture, where it was quite easily seen and you can actually see a red glow and it's easier to do the surgery. This one becomes a little more difficult. I mean, you can the lens actually comes a little forward, and doing the procedure for us, it will be very difficult. And I said, now the patients have slowly started coming back to the clinics. We are seeing more of these difficult cases, and our surgery is getting more and more difficult. Like a surgery I did in the morning, I mean, I had a tough time doing it. But of course, I mean, everything went on well. But the point is, that is precisely why we should not delay the, seeing the doctor if the problem is affecting you, a foggy vision or a blurry vision in the distance. You're seeing your distance vision getting blurred with your glasses or spectacles, and you're having problems in driving in the night with the glare and all. You should not delay at this point of time, just because of this COVID. That's what I'm saying. I mean, before it becomes too late, and it gets complicated. Now that's about cataract. I mean, then we come to the in a COVID era. I mean, why would you come? The main problem is, when you get scared or you get paranoid about going to the hospital because you see the numbers are increasing every day. So it gets a little, scary to actually go to the hospital. But when you look at these figures, I mean, the recent data, I mean, from the National Program for Control of Blindness, it shows that on an average, we were doing around 5.5 lakh cataract surgeries in a month in India. I mean, that's the amount of, backlog we are facing. Because when, recent onset of COVID has led to closing of these screening programs. Most of the camps were stopped because of the COVID. And so there is no screening programs, and there is no free cams and free cataracts going on. So across India, I mean, this is the kind of backlog we're talking about. 5.57 lakh cataract surgeries a month, which was being done, is not being done. So that is the kind of backlog which is increasing. So that is why we have slowly we have to start thinking about the kind of, the numbers we have to see. I mean, the mature cataracts or the significant cataracts we may have to see in the near future. So I just gave an idea about what's the backlog we are actually facing. So what can be done during the cataract surgery when, I mean, in a COVID situation? I mean, most of the cases in a clinical scenario, how do you see? I'll be coming to that a little later, in the sense like, what are the precautions we are taking in a hospital if a patient come at this particular time? But during the surgery, what are we doing? Every case before, actually, I mean, previously we were doing it without the COVID, this thing, but since the numbers are increasing now by the government norms, we are doing RT-PCR tests before doing any elective procedures, including cataracts. So and that will be valid. I mean, this test, each time the test is valid for around 3 days. So we'll be doing the procedure in 3 days. And most of the cases, if it's like 2 eyes, we can actually do in, 1 day we can do, and the next day we can do the other eye also. We've done that, something like that. And the number of surgeries, generally we are reducing. I mean, because to avoid cross infections and all. Modifications are incorporated in the steps of the surgery. That is for us, actually, which minimizes the duration of the procedure, or generation of aerosols. Aerosols is the main thing, as you all know, which can cause the spread of the disease. Even though it is less important in an eye setup, but still we try to minimize the duration of the procedure and generation of aerosols. The disposable materials are used wherever applicable. The operating room is cleaned after every case. We actually put UV light it's exposed to the theater space for around 1 or 2 minutes after each case, and then cleaned also. And the necessary time gap of 20 to 30 minutes between each procedure is maintained. I mean, after all the cleaning and the UV this thing, we keep a gap of around half an hour between the cases. And the post-operative period, usually after the surgery, we see the patient the next day and the next week and the next month. Some of these things, if it was an uneventful surgery and there was no complications, and we are arranging teleconsultations during these pre-op visits. So that is one thing we are doing also. So the cataract surgery has evolved into a new normal. So, I mean, rest assured, most of the people who are like, hesitant to come to the hospital for a treatment of cataract and cataract surgery can be, I mean, we are taking the strict precautions because we are also at the risk. So we are doing most of the norms which are specified by the government, and we are also doing the same thing during our cataract surgery. At least in our center, that's what I'm saying. Okay. Now, after the cataract, I said the most important thing now is the retinal diseases. We are talking about the dependents, the older age group people who are like in a situation like this. What are the things which they should be more bothered about? So after the cataract, the most important thing is the retinal diseases like diabetic retinopathy or a retinal break or a retinal detachment or an age-late macular degeneration. So these are the conditions which we should be thinking about. First and the most important one is the diabetic retinopathy. Most of the people who are like, non-insulin dependent diabetic, which is most commonly seen, should have, I mean, we used to say that you should, I mean, if their sugar control is not so good, we should at least have a 6 monthly to 1 year checkup, if it is like a normal case. But if these patients were already under the treatment of some ophthalmologist or a retinal surgeon, and they were getting treatment like laser or injections, it is now it's already quite late that if they are not seeing, like 3 to 4 months to 5 months to 6 months now. So if they have not seen a doctor, if they are not following up, it is significant, and it can be vision threatening also. So you can see in this cartoon now, it's like a normal eye, and then in a diabetic retinopathy case, you can see this. There is tiny blood vessels which leak fluid into the retina. So that's what's happening in diabetic retinopathy. And some of the pictures, and this is the vision, and the normal vision you can see in the left-hand side. You can see a normal vision, and in diabetic retinopathy, you can see these patches. Any patient who's having a diabetic retinopathy can appreciate this actually. But we don't have to go into this stage. At any stage, we can prevent this thing from happening by taking the proper treatment and early diagnosis. I mean, some of these pictures, I mean, this is the center one. What you can see is a normal retina, where you can see the blood vessels and the optic nerve very clearly. In a case of a mild diabetic retinopathy, this is the earliest stage. Mild diabetic retinopathy, you can see these small blood vessels which is burst, and it's like a little bit of bleeding there, here and there. At this stage, if you have these are the reversible stages. These two pictures which I have kept, the mild, the moderate stage, is the reversible stages. So at this stage, if you come to the hospital and we can have a check and control a diabetic diabetes, metabolic control, then you don't have to, and this won't change into this more dangerous situations. So this is a mild and a moderate stage. And on the right hand side, you can see the proliferative stage and the vitreous hemorrhage. This is like a bleed into the eye. So, I mean, we don't have to wait till it proliferates or it progresses into this stage. That's why an early referral and a diagnosis is very important. Right, an early stage. I mean, what we can do in an early stage, you saw that mild to moderate stage. We don't do that in a mild to moderate stage also. Once the moderate stage comes to the severe stage, you can see new vessels in the retina. At that stage, you do this relatively simple procedure called the laser treatment. You are still sitting by a slit lamp, you can see that. And, there will be a green laser by which we burn the peripheral areas of the retina so that the central vision is saved. So this is what I said. I mean, in the early stage, if the patient goes to an eye surgeon and at that stage we find out, then we can do a laser and prevent that bleeding and all those things from happening, like I showed you in the last page. If it comes to the bleeding stage, or if it goes to the next stage, then we have to do a surgery. I mean, this is a relatively complicated procedure, not like a relatively easier cataract surgery. We have to go, as you can see, some of the instruments we are putting behind the eye, behind the lens. And this is like a lengthy procedure, and we have to clear the retina of the blood. So, I mean, this again, if you had come to the eye surgeon or the doctor earlier, then we could have prevented this from happening. So that is one thing we have to remember. Now, the next one, I mean, that is the retinal break. I mean, you can see the retina, in this cartoon, you can see that there is a break there, and then the fluid is egressing and causing a retinal detachment. Now, what are the symptoms you should be worried about at this for a retinal break? This is what you will see usually in your visual field. You can see these floaters. I mean, this is a classical thing. A lot of us will have this problem. You'll see these worms or, something floating in your visual field, and, you'll feel like it's like a fly or something, and you want to move it, but it's not. I mean, wherever you move, it will move with you. And sometimes you'll see these flashes. You can see this right side, you can see a flashlight. if you see a floaters along with flashes, I mean, at that time, definitely you should see a surgeon. I mean, you should not delay, because you may be I mean, preventing a retinal detachment from happening. I mean, I'll show you that. Yeah, if it is a retinal break, you'll see a small break in the retina. At that stage, if you see us, I mean, maybe just a floaters. At that stage, if you see us, then we can do these lasers around that. I mean, we cannot literally go there and patch the break, but if you can do these lasers around, and we can prevent this break from extending into a detachment. In the right hand side, you can actually see that fluid ingressing into the tear, and then lifting the retina out, and then finally it becomes a total detachment, and you may need to do these complicated surgeries. So again, floaters and flashes, if you have, it is mandatory that you should see a surgeon and have a dilated checkup to rule out these breaks. So this is again another condition you should not delay. Right. And the next one is the age-related macular degeneration, which is relatively newer. I mean, awareness of this condition is a little less. I mean, most of the people will be like waiting, thinking that it's cataract, but actually it may be a macular degeneration. On the left-hand side picture, you can see the macula, it's a normal one. On the right hand, you can see the damaged macula, which is usually seen because of the age. This is the kind of vision you will see in AMD, or age-related macular degeneration. You can see the normal vision, and you can see the vision with AMD, where your peripheral vision is still okay, but your central vision is compromised. There are two types of AMD. There is a dry AMD where you can see a pigment clumping there, and on the left side you can see a bleed, or a wet AMD. And this is more significant actually. Right. I mean, this can be easily treated in an early stage by giving an injection to the eye. There are these anti-vascular endothelial growth factor, which we can inject into the eye, which can prevent this from further damaging the vision. So this again needs an earlier appointment and seeing the doctor. And most of these conditions will be already under a retinal surgeon, or a doctor will be seeing it. They are just they have just missed their appointments for the next injection, because most of these conditions will have
Sachin sir is facing some technical issues. He'll be there. I'm so sorry for the technical glitches. Please stay tuned. He'll be right back. Sir is facing some technical issues. He'll be right there. Please stay tuned. This is for the viewers who are viewing us live. Please post your questions in the live chat of YouTube of our YouTube channel. Your questions will be answered live in the session.
Hello.
Yes, sir. Yes, sir.
Can you see me?
Uh,
One second. Yeah.
yes, sir. Now I can see you.
Right. Let me share the screen.
Yes, sir.
One second. Yeah. I think I should start from here, right?
Yes, sir. That's right.
Okay. Right. All right. So sorry for the technical issue I had. So let's come to that other common thing which you usually see in you know in a condition. I mean, this red eye is actually otherwise also it's pretty common, but in a COVID-19 situation, what's the relevance? When a lot of cases they say COVID-19 usually presents as a conjunctivitis, but it's not been proven. It's not been published in Indian scenario, but a lot of cases initially when they were seen in Italy and China, there was small groups of presentation like that. But wherever you see a red eye, you should actually again see a doctor because it can be as innocuous as like a viral or a bacterial infection. Like in the right hand side, you can actually see the left hand side. This can be a viral infection with a matting of flashes, and you can see the diffuse congestion. But it can be a little more serious condition like a corneal infection, where you can actually see there is an infection on the cornea. There is this whitish thing on the eye, which is more serious, and you need a little more. I mean, the dose of the medication has to be applied more frequently, and it needs a close follow-up. And the right hand side, you can see there is a lot of discharge and it can be a bacterial infection. So, I mean, any red eye, if it is like staying with you for 1 or 2 days, it's better to actually show it to a doctor before, I mean, starting your own treatment. Most of us are like starting our own treatment because of the COVID scenario and we like scared to see a doctor. But I think you should show it and rule out what is the condition. Another condition is like uveitis, which is like not a superficial. It's more of a deep condition. I mean, the deeper layers of the eye would maybe like so that uveitis is a little more. Uh, Again, it needs a more closer follow-up, or a glaucoma, which is a little. That needs a lot of care. I mean, when you see this, the chamber of the eye, you can see that from the side view, you can see that the chamber of eye gets shallow, and then you need a laser. I mean, just by a laser treatment, actually, you can prevent this thing from getting worse. But we'll be just sitting there thinking that it's a red eye, and then we won't be taking the next step. So that is why glaucoma. I mean, we have to rule out this, and that's also very important. And sometimes it may be a small flap. You can see that on the cornea there is a small tear and a flap. There is an eyelash under it. So we have to do a suturing. Otherwise, this is going to turn out into an infection, and it will be like even worse. Foreign body, which is a very common thing, which is usually seen, and if you don't do anything about it, you can again get infected. I mean, you can take it out with a simple step in a slit lamp with a 26 gauge, 28 gauge needle. So that again needs a referral and should see the doctor. So finally, I mean, these are the conditions which is a little more serious and needs a referral and early diagnosis. I mean, digital eye strain, which is again, as the moderator said, this is the one which we are really bothered about nowadays, because the the new schooling, which is a new normal again, where you can, most of us are like having this internet and through online teaching. So digital eye strain, why it is significant? Because we are like spending more time with the computer. We are not blink. This is the most important thing. Why it is happening is because of a dry eye. It's an evaporative dry eye, which is happening because of the constant watching these monitors. Yeah. So, I mean, what is happening? I mean, because of the decreased frequency of blinking, the tears are getting evaporated fast. So, over a period of time, we have the symptoms of grittiness, foreign body sensation, and watering, and it will be generally a very unpleasant scene at the end of the day. So we can prevent this thing from happening by doing some simple steps like these: 20 minutes, 20 feet, 20 seconds. And every 20 minutes, take a break for 20 seconds, look at an object 20 feet away and come back to your work. That is a simple step by which we can actually prevent this thing from happening. And again, I mean, there are some things which we can usually do to prevent this thing, digital eye strain, from happening. And like this picture is shown, we can have a proper lighting. Most of us will be sitting in a diffuse lighting, which is not very good. We should have a task lighting. That is more then regular eye checkups. I mean, we should actually check, because most of these kids are like spending more time on the monitor. We should actually see whether they are having a refractive error. If there is a refractive error, we have to correct it. So that's the first thing: eye testing. Then eye exercises. Like I said, you move the eyes and you take frequent breaks. Proper lighting, like a task lighting, will be more proper. Monitor cleaning. I mean, most of us will have a lot of dirt on the monitor, so that's again, I mean, hampers the vision. Distance adjusting, glare reducing. We can actually put an anti-glare screen on top of that. And then frequent blinking. The most important steps are like frequent blinking. And if there is a refractive error, we should correct it and put the glasses. And then this 20-20-20 rule, which is extremely important, and you should do it. The last one is called palming, where you actually rub your palm. I mean, you create a little bit of heat and then, put it over the lid. And that will again reduce the evaporative dry eye. Now, I mean, another group which is, I mean, again, significant is the contact lens wearers. I mean, there are a lot of contact lens wearers out there. They have to be a little more careful. It doesn't mean that you have to stop wearing contact lens totally. But, I mean, because, touching an eye or touching this thing is extremely dangerous in this current scenario. If possible, you can keep, you can use the glasses more often. I mean, you don't, but you can keep wearing the lenses. There is currently no scientific evidence that contact lens wearers have an increased risk of contracting COVID-19, so you can still use it. But before that, you should have a good hygiene habits. That's very critical. Hand washing and drying are essential, as well as properly cleaning and caring for the contact lens, which you usually do it, but now we have to do it even more. And regular glasses, but like some of them, they say that regular glasses often protect against COVID-19, which is, there is no scientific evidence for that. So keep unwashed hands away from your face, whether you're wearing a lens or not. You have to keep it away from your eye. And if you're sick, generally, like you have a fever, which is more towards COVID, then you have to temporarily stop wearing the lenses. So in Chaithanya, what you are doing, I mean, after discussing all these eye problems, Chaithanya, what are we doing to stop this, COVID from, in a patient coming to Chaithanya initially, you can actually see that we have a sanitizer at our doorstep, and then we do this temperature check, and then we have this, we take the relevant questions, like, whether you're coming from a locality which is having COVID, or do you have an exposure to someone who's having COVID. And then, you can see this social distancing at the waiting area. You have stickers posted, which is, we have a distance between the patients, and You can see our staff is like wearing full PPE, and even the doctor, have a face shield and a full PPE before seeing a patient. And we see only one patient, and the attendant usually sits outside. And if it is like a very elderly patient, we allow one patient, and we allow one attender also. And then you can see the instruments are cleaned very regularly between each patient. And we try to try to avoid all this cash dealings mostly, and we have the cards. And all our staff is also well equipped with that. So we have a set pattern, or some of the things in place from the start itself, and we are following it very stringently. And if red eye and things like that, which can spread, can contaminate, we see them in a different level. We have 2-3 levels of the hospital, and so we see in a different level, and then different staff for them. So that is very important. And so that is what I want to. There are lots of things to talk about regarding this, eye diseases during the COVID pandemic. But at least I wanted to make sure that some of these steps are not missed actually. So as a conclusion, we would say that protecting your eye health is important. You can wash your hands. You can use your common sense and keep healthy and stay safe. Wash your hands a lot. Follow good contact lens hygiene, like I discussed. Avoid rubbing and touching your eyes, and stock up the eye medications. Like example, glaucoma medications. Some of these medications are not available now, which are coming from different parts of the country. So if you have glaucoma and you need something like lifelong medications, you stock it up. And call or visit your ophthalmologist if you have at least these conditions. This is the take home. You have a macular degeneration or a diabetic retinopathy, and you are on close follow-up with the retinal surgeon, and you are getting regular eye injections, please go and see the doctor. That's very, very important, because you may be progressing, the disease may be progressing, and you may not know. You notice changes in your vision, like foggy or blurry or wavy or blank spots in your field of vision, like I discussed, there is a floater or a flash or a foggy vision, you should see a doctor as early as possible. And yeah, you notice a lot of flashes or floaters, you should see a doctor. Suddenly lose vision, you are okay, and suddenly there is a loss in vision, you should see. Eye pain, red eye, headache, nausea, vomiting, you should see. So these are some of the conditions this COVID pandemic or a scenario should not stop you from seeing. Right. So that's it. Thank you.
Okay, thank you so much, sir. Now that you have covered almost everything in the session, we have some questions from our viewers. The first question is, how exactly does coronavirus affect our eyes?
No, it's not like the coronavirus is affecting the eye. Coronavirus is affecting the entire body. It can be actually seen in tears also. But rarely, sometimes it is seen initially as a conjunctivitis. That means only a red eye. And in a very rare cases, but it is not that. It is very rare that coronavirus usually seen in only the eye, but it can happen. So that is what.
Sir, what symptoms does it cause to our eyes?
It may be just a redness. You may be seeing. You will have a little bit of feverish, and if you have a fever or a sore throat, and on top of that you have a red eye, that should be a red flag. You should be thinking, where did I go last few days? Did I come into contact with anyone having a corona? At that stage, you should actually, you should share the whole information with the doctor also, because, it is, treatment-wise, there is no much difference, because most of these viral conditions, you just have to wait for some time, it will clear off. But, it should start a red flag. If you have redness and if you have a fever, then you should start thinking about it.
Okay. Sir, next question is, how often do you recommend should one return for a comprehensive eye exam?
And that depends on what sort of condition you are in. If the problem is, initially we were thinking that it's going to clear off in a few months. 2-3 months, it's okay. But now the thing is, it is already 6 months. This thing is extended. So people who are having any sort of old age, 55 and above, you're having a vision loss, or even if it's like a slowly progressing vision loss, you should see a doctor, because we have to rule out other conditions. It may be as innocuous as a cataract, but it can be as significant as a diabetic retinopathy, and which is sometimes causes an irreversible blindness. I mean, so we have to sort of see. So comprehensive eye checkup, like for example, in a diabetic case, we usually say okay, 6 months to 1 year. But in this scenario, 6 months we already waited. I think if there is any significant symptoms, you should see it out.
Okay. Sir, a lot of people use specs, but one doesn't get to know how his or her number is changed. So, is there any specific thing that we can do apart from, suffering from the difficulties that we face?
No, I mean, you mean see the glass prescription, right?
Yeah, yeah, yeah.
That again, that is something which is like a little more easier to treat. I mean, that must be the easiest part. I mean, it's not the scariest one, which I already told. But still, since this online classes have come, the kids who are like most of the time seeing the near work, I mean, continuously doing the monitor work, if their glass number, as you said, has not been changed recently, this is the time to check, because they may be having the extra strain they're taking or doing it to do this. So at that point, the first thing is you should check it. I mean, because this is again not going to change. The schools are not going to close. Sorry, start again in the next few months. So that if they're showing some amount of headache, that's why I said headache or vomiting sensation or some discomfort, you should show it and check the number. Yeah.
Okay. Sir, a lot of people face the problem of night blindness.
Yeah.
So, how to cope up with it?
Night blindness is a big topic. I mean, it's a vitamin A deficiency, and that is again night blindness. And before actually branding it as a vitamin deficiency and all this stuff, you should check what exactly. Why is he having that difficulty in the night vision? It may be a glaucoma, early start of a glaucoma, because peripheral vision, and sometimes it may be diabetes and causing this peripheral vision loss, or dark adaptation may be less. So, what exactly is the cause? We should find out, and then only we can treat it. I mean, depending on the condition, we can treat each condition separately.
Yeah. Okay. So next question is, with this changing lifestyle, how can one make to prevent or reduce risk of eye disease?
You cannot prevent eye diseases from happening. We have to be cautious as to don't delay the management of the eye diseases. I mean, as I said, the eye diseases is like a big term, right? We have to find out whether we have to teleconsult or actually go and see the doctor to find out whether you're having a eye condition which is not so serious or something which is like very serious, and then that is the thing. Sometimes you may be sitting on, like for example, glaucoma causes vision loss, cataract also causes vision loss. Sometimes we may be just sitting it thinking that it's going to go off, but if it is glaucoma, we are like losing vision every day. So that is why, I mean, we have to sort of differentiate what exactly is going on. I mean, what is your condition? Or we have waited 2 months, 3 months, but now it is quite 6 months, 7 months. It is like, I mean, I think we have to take.
So the problem is getting worse day by day. Yeah.
Correct.
Okay. So last question is, any special healthcare rules that doctors as well as the patients need to follow during this COVID scenario?
Some of these things, what I said is, it is not pertaining to eye itself. That's why I said we have to be, use your common sense and stay safe and healthy. That's what I say. Wash your hands. I said, say, wash your hands, and avoid touching mouth. And of course, the mask and sanitizers now everyone uses, but I think it's the new normal. I mean, we have to be extra vigilant because the number of cases are increasing. We may be like contacting an COVID patient the next, we are at more risk, but at least everyone, going to a shop or maybe going to a relative's house or anyone. You may be just sitting next to a COVID patient. So you have to be careful. You have to avoid touching the face, avoid touching the nose. Wash before and after. We have to increase our hygienic habits, which we had a little more. That's the thing. You have to be more smart and stay safe. That's the thing.
Okay. Thank you so much, sir. With this, we come to an end of the question answer session. It was a great session, and it was needed for everyone, because almost everyone is facing the eye issues, considering what scenario we're going through. And it was a great session. Thanks
Thank you.
for actually opening our eyes, about what tips we need to follow.
No,
So
something is
thank you.
going on. Some of the steps, yeah. Okay.
Yeah.
Right. Thank you.
Okay. Thanks a lot, sir.
Thank you.
Sir, can you stop the screen share? So I have some more slides to
Yeah,
show.
sure. I'll just stop sharing it.
Yes. Okay.
Yeah.
Okay, to the viewers who are viewing us, do share your feedback to our YouTube channel as a comment. For advertisements or sponsorships, you can mail us at joinprayaana@gmail.com. Thank you so much for your patient listening. Thanks a lot. And with this, I conclude today's session.